Watching your child struggle with chronic health issues is heart-wrenching, especially when you've seemingly tried everything. Parents of children with autism, ADHD, epilepsy, PANS, PANDAS, allergy, asthma, and so forth continue to tell us they've not only exhausted the traditional medical route and received little to no help from specialists and neurologists in that world, but they've also now tried virtually everything natural and holistic, like diet changes, detoxes, supplements, primitive reflex therapies, and more. But what if I told you there's a crucial piece of the healing puzzle that most doctors and natural health practitioners overlook entirely? In this video, we'll break down exactly what that missing foundational piece is, why it's so easily and often overlooked, and how the most important aspect of helping your child heal is not just doing all the things, but most importantly, learning how to do things in the right order or sequence, where the basics of healing are put in place before we go after brain-based healing and recovery. Let me share Hannah's story. At 11 years old, Hannah was diagnosed with psoriatic arthritis, and she faced daily battles with nausea, headaches, digestive issues, chronic fatigue, anxiety, and depression. Her family tried everything, from supplements and special diets to cryotherapy and even chemotherapy. Nothing provided lasting relief. Hannah reached such a low point that she felt empty and didn't want to live anymore. But everything changed when Hannah walked into a neurologically focused chiropractic office. After her very first adjustment, she experienced immediate relief, sleeping through the night, feeling less nauseous, and regaining her appetite. And today, Hannah says the light at the end of the tunnel is there. And I can now say that with absolute certainty because I see it. Not only is Hannah thriving with her health and quality of life right now, but she's already started her college career looking to become a natural health practitioner and pediatric chiropractor in order to help more kids and families get these answers and find relief before they have to suffer and struggle so much. That's the ripple effect. And this is the story for so many patients in our office where parents have exhausted their options with the conventional system. They've seen the specialists. They've done all the tests. They've seen the neurologist, the immunologist, the gastroenterologist, the psychiatrist, you name it, only to get more diagnoses, more medications, and unfortunately, more side effects to come along. And these parents have not only done that, but they've awesomely been up late at night researching, switch gears into the crunchy, holistic, functional, biomedical world as well, but are still experiencing challenges with their child after trying the detox, after trying the diet change, the hyperbaric oxygen chamber, the lasers, the homeopathies, and other natural remedies. And sometimes we're seeing changes with these things. Sometimes sleep does improve, anxiety lessens, and the symptoms and challenges improve. But for some, they're not seeing that forward progress. There's change, but it's very little, and results have maybe entirely plateaued. And if you fall into that camp with your child, if this video is starting to hit home just a little bit, we see your exhaustion and feel your frustration. What is so encouraging is that when we see families who have had this type of experience and they then start their child under nervous system care, it's only a matter of time before they start seeing the changes with sleep, with allergies, with emotions, energy, insert XYZ challenge or symptom, they see improvement. And this video is about understanding why this is the case. It's not just genetics, it's not just gluten or gut issues. It's the nervous system that holds the real key to healing. Your child's nervous system develops first in utero and controls every other bodily function and core system. And it controls and coordinates all of development from the very beginning. It's the master control for gut health, for immune function, emotional regulation, and everything else. And when the nervous system is overstressed and dysregulated, other treatments and therapies can't work to their full potential. A great analogy for this is like building a house on a shaky foundation. Imagine you spend time and money on the best furniture, you got great decorations and a high-end appliance for your dream home. But if the foundation is cracked or unstable, no matter how much effort you put into the rest of the house, you'll keep facing problems. The walls are going to crack, the doors won't close properly, and the floors, they'll start to sag. Until you fix the foundation, all those other improvements won't function as they could or should, and you'll constantly be frustrated by these ongoing issues. Similarly, when it comes to your child's health, you can try all the therapies, the diets and supplements, but if the nervous system, the body's foundation, is dysregulated, those efforts won't have the lasting impact that you were hoping for. So we've got to work from the ground up, and that's where neurologically focused chiropractic care comes in, to help stabilize that foundation, allowing everything else to fall into place and to work better and more effectively. But you might be thinking, how does the nervous system get off track to begin with? How do we get in this place in the first place? When we look into neurodevelopment, there are critical times in development that are more impacted by stress and environmental factors than other times. Essentially, when the nervous system is most vulnerable, it's more susceptible to be influenced in positive ways, but also in negative ways. It's the concept of neuroplasticity, essentially the nervous system's ability to learn and be influenced by its experiences. And those early life experiences can look different for every single child, which can cause their nervous system to express differently. Some parents experience fertility challenges, and others experience high levels of stress during pregnancy. This can negatively affect the developing nervous system of the baby on the inside. Other influences come during the transition from inside the womb to the outside. Birth interventions, C-sections, forceps, vacuum extraction, induction, etc. This can create physical trauma and injury to the brainstem, to the vagus nerve, and other key players within the nervous system. And then a third major factor we observe is how early exposure to antibiotics and toxins can further compromise the system, which then triggers inflammation, gut issues, and many more problems that complete this storm and keep that child locked into a dysregulated state. And if we don't address these challenges from a foundational level, challenges tend to persist. This is why we need to fix the foundation first, so that other therapies, other treatments, other good things can be more effective. The body follows a specific developmental sequence. Nervous system, motor system, gut and immune health, and then we have the brain. And when the foundation, the nervous system, is compromised, treatments targeting the other systems have limited effectiveness. And this explains why so many children show minimal improvement despite trying numerous interventions. And we're going to talk through what that looks like visually. I'm going to jump on the iPad right here, and we're going to see from a foundational level. I'm still here, by the way. We're just going to be going through it on this iPad and seeing and understanding that this sequence of healing, this sequence of neurodevelopment, it starts with the foundation. It starts with the nervous system. It's going to influence how our system continues to develop. And this first happens in utero with the new neural tube. With the nervous system, it's going to dictate how the heartbeat is happening, how breathing happens, how digestion happens, how we move, how we digest, all of these things. Then comes the motor system. Motor system is really important in how our nervous system continues to perceive its environment. What is the quality of the input or the signals that the brain is receiving? When a child is moving, when they go through motor milestones, it is the stimulation to the brain that the brain needs to access the higher centers of the brain. Because when we start with neurological development, it starts from that more primitive angle. It starts with the brainstem. That controls breathing, that controls sleep, that controls the basic functions of life. And how we continue to grow and develop is through that stimulation. Stimulation is what creates new neural connections. We learn. And how do we learn? We learn through movement. And the motor aspect of our system is what drives that continued development. But it's dependent upon what is the quality of our nervous system? Because if our nervous system is in a more protected state, if our nervous system is focused more on fleeing or fighting or protecting itself or being in stress mode, it's less focused on having a great digestive system. It's less focused on having a good regulation of emotions and behavior and all of these things. Because these are the steps that follow the foundation. And these are the stressors, if we look on the left side, these are the stressors in this order that we see that continue to affect how the nervous system develops. This is the perfect storm of stress starting at the foundation that then leads to different stressors on the motor system, that then leads to different stressors on how the gut communicates to the brain. And we have some awesome, awesome parents and people going into the gut and the immune system and how it affects the brain and how it affects behavior. And they're going up the right tree. But we're kind of here at the trunk where we need to be at the roots of how the nervous system heals, how the nervous system is what's going to dictate whether or not we have low stomach acid or high stomach acid so that we can actually digest the good things, the diets, the nutrition, to have our system in a calmer, more relaxed state so that when we have the detox, when our system is filled and full of things in our liver, in our kidney, and it's not detoxing its system, what is the quality of the nervous system and how it's perceiving those things and dealing with those things and actually letting go of those things? So when we go through these things with counseling, with functional medicine, with all of these therapies, for a lot of parents, when they get this seemingly new, for a lot of parents, it's a new approach. It's a different approach. It's a different way of looking at health. A nervous system focused chiropractor addressing this foundational level, we start to see things start to change in a big, big way. And it doesn't mean that these other therapies and these other things that we can do aren't good things. But if we're not addressing the foundation, it's going to impact the quality of those things. It's going to impact how impactful those things can be. So understanding this sequence is going to allow us to get healing in the right sequence. When a child starts under care at our office, let's get back to here. We don't get to dictate how their body starts to heal first and what improvements start to take place. We can't say like, hey, we want the kid to start pooping after we adjust them. Hey, we want the kid to start sleeping. We want energy levels to go up. What we do is help to influence that foundation in a major way. Then our hands are off. Healing happens between the visits. What we tend to see first, when a child gets adjustment, we see improvements in sleep, we see energy levels go up, we see them being able to take that deep breath, their shoulders to go down, to calm, to relax, they're overall more comfortable. Subtle changes over time. Sometimes they sleep and they sleep hard. Sometimes they start progressing through milestones. We adjusted a kid and he started rolling over. Think of what happens in growth and development mode. When we're affecting the foundation, when a child is in growth and development mode, when they're in rest and digest mode, sleep, digestion, gut function, behavioral regulation, all of these improvements can all happen when we address the foundation. And we can do that through neurologically focused care. And when we address the foundation first, we start to see some really cool things happen. These improvements often make other treatments more effective because the child can be in a better ready state and not battling exhaustion, not battling digestive and immune issues, sensory challenges, and overall dysregulation. Their nervous system is more open and accepting when they're not operating in protection mode all the time. And that's really where neurologically focused chiropractic care comes in, by addressing that foundational component, addressing what's causing the imbalance to stay stuck within the nervous system. Because the cause can be toxins, it can be mold, it can be an allergen, it can be an environment that's riddled with stress. Stress can be that initial trigger that sets the system off. And addressing those things is important and will lessen the stress on the nervous system. But are we just manipulating our environment to fit the quality of the system? Or Do we elevate the system's ability to handle that environment so that the system is more resilient? Because life doesn't put a pause on stress. I mean, ideally, we're doing both. Both is key to optimal healing, minimizing stressors and building the resilience of our systems. But if we don't address the underlying dysfunction, if we don't address how the nervous system has adapted to stress, to toxins, to birth trauma, to life, it remains in protection mode. And its function and how it controls how it will interact and continue and grow and develop with every aspect of life, it's going to be altered. So what does that look like? How can a child experience these changes? What do we do? How can we help? If you're feeling like Hannah's mom and you're exhausted from trying everything and still searching for answers, there's hope. Neurologically focused chiropractic care might be the foundational missing piece in your child's healing journey. And it all starts with first finding out if your child's nervous system is indeed dysregulated. How do we do that? We can do that with some technology. It's called the insight scans. I'm going to show you what that looks like specifically. It's going to show you if your child's nervous system is dysregulated, and if it is, to what degree or severity, and where is that primary dysfunction? Where is that nervous system stuck? Where's it located? And then we can fully develop and map a personalized care plan and adjusting protocols that matches your child's unique needs. It's not a one-size-fits-all. Every child's story is different. Every child's level of care and protocol and specialty and how they are cared for should be different as well. So what we do is we provide care in a way that is gentle adjustments that help restore nervous system function. And it helps to create an environment where other treatments, again, can show and work more effectively. Now I want to show what do those scans look like. Now these are scans from a little boy. He was fully locked into autism. And he presented to a PX Docs clinic having tried literally everything. His family had exhausted all the traditional therapies, PT, OT, speech, and they tried and exhausted the functional or integrative approach. He presented with the chiropractic care office already on over 30 different vitamins, supplements, and detox agents, trying to help this dysregulation he was experiencing. And not only was none of it working, he was getting worse, not better. And as you can see, when we dive into these scans, specifically this one here, his autonomic nervous system, how his nervous system is responding, and his neuromotor system, is a mess. There's no other single treatment, therapy, no matter what it was, that was going to get him through this because his system was so dysregulated. Because when we look at what are these nervous system scans telling us, we can see where's the nervous system operating. So this is a neurothermal scan. This is showing where are their activity, where's their areas within the nervous system active, where is the dysregulation happening. And what we're seeing was a lot going on up top. A lot of stress, a lot of tension, a lot of subluxation, a lot of dysfunction, interference within the nervous system at the level of the brainstem. And again, this controls those basic functions of life: eating, sleeping, breathing, heart rate. So when the system is experiencing more stress there, it's going to influence the function as well. Because the other thing we're seeing is this area specifically. One of the things that he was coming in with was chronic constipation. His system couldn't relax. It couldn't perform that function of having a bowel movement in a comfortable way. His system, when we look at where specifically where the shutdown was occurring, the wires that come from this area, let's draw this in yellow just to show a little bit more. Woo, here we go. The wires that come from this area not only go to his bowel, his bladder, his reproductive organs, but specifically this area goes to his adrenals, goes to his liver, goes to his kidney, his detox pathways. Fully stressed out. And when we see that, and we see a child presenting with that long term, their system is going to be experiencing much more stress. Their system and how it perceives its world when it's being stressed out on the inside is going to be even more stressed out by other things on the outside. When we look at it from a neuromotor standpoint, this is energy on his system. This system here shows us how much tone, how much tension, where is the nervous system holding onto that. It was all in this upper cervical area. It's all within his system here. And again, this all feeds into his brain and tells his brain, hey, there's a lot of stress going on, not only from this functional level, but from an energy standpoint as well. We're perceiving all of this extra noise, all of this extra stress, all of this extra tension. So what's the brain like? The brain's perceiving stress. It's to respond in stress mode, and it stays there. So the initial stressor or perfect storm of stressors, whether it was birth trauma, whether it was that fertility period, whether it was early infancy, whatever it was, that starts to stack on the system and influence how the brain continues to function long term. So what we do in our office is we take these scans, we track these scans, we see how does a child continue to develop, how does a child continue to improve, and how can we help a child continue to heal. And if this exact sort of case and when nothing works scenario sounds like your family's journey, then make sure to visit the link in our bio to learn more. Don't give up hope, parents. So often the breakthrough you're looking for starts with going back to that foundation and starting fresh from there. If we can be of help, reach out today to learn more about how we can help your family finally experience the healing you've been searching for. That's all for this video. Be blessed and have a wonderful day.